What is the effect of beta blockers on the heart? Increase heart rate, increase contractility, decrease cardiac workload, increase conduction velocity. Correct answer is option C, decrease cardiac workload. Which type of anemia is characterized by large immature RBCs? Iron deficiency anemia, aplastic anemia, hemolytic anemia, megaloblastic anemia. Correct answer is option D, megaloblastic anemia. Which of the following is a contraindication for thrombolytic therapy? Stable angina, ischemic stroke within 3 hours, active internal bleeding, history of diabetes. Correct answer is option C, active internal bleeding. What is the main side effect of ACE inhibitors? Persistent dry cough, hypoglycemia, diarrhea, hypernatremia. Correct answer is option A, persistent dry cough. What is the function of albumin in the blood? Oxygen transport, pH buffering, blood clotting, maintains oncotic pressure. Correct answer is option D, maintains oncotic pressure. Which lab value suggests a therapeutic INR for a patient on warfarin? 1.0, 1.8, 2.5, 4.0. Correct answer is option C, 2.5. Which structure allows electrical signals to travel between cardiac cells? Desmosomes, gap junctions, tight junctions, synaptic clefts. Correct answer is option B, gap junctions. What is the normal range for central venous pressure? 0 to 2, 4 to 12, 15 to 20, 20 to 25. Correct answer is option B, 4 to 12 mmHg. Which antibiotic can cause tendon rupture, especially in the elderly? Ciprofloxacin, ceftriaxone, azithromycin, metronidazole. Correct answer is option A, ciprofloxacin. Which is a characteristic finding in nephrotic syndrome? Hematuria, oliguria, proteinuria, pyuria. Correct answer is option C, proteinuria. A nurse is preparing to administer IV phenytoin. What precaution is necessary? Dilute with dextrose, administer rapidly to prevent seizures, use a large bore peripheral IV, infuse with normal saline only. Correct answer is option D, infuse with normal saline only. Which type of hypersensitivity is responsible for hemolytic transfusion reactions? Type 1, type 2, type 3, type 4. Correct answer is option B, type 2. Which vitamin is necessary for proper vision and epithelial integrity? Vitamin D, vitamin K, vitamin A, vitamin B2. Correct answer is option C, vitamin A. Which lab marker is most specific for acute pancreatitis? ALT, amylase, AST, lipase. Correct answer is option D, lipase. Which fluid compartment contains the most body water? Intracellular, interstitial, intravascular, transcellular. Correct answer is option A, intracellular. What is the major adverse effect of aminoglycoside antibiotics like gentamicin? Hepatotoxicity, ototoxicity, hyperkalemia, constipation. Correct answer is option B, ototoxicity. Which electrolyte is involved in transmission of nerve impulses and muscle contraction? Chloride, calcium, phosphate, bicarbonate. Correct answer is option B, calcium. A patient reports sharp chest pain that worsens when lying flat and improves when leaning forward. What should the nurse suspect? Pulmonary embolism, pneumothorax, pericarditis, myocardial infarction. Correct answer is option C, pericarditis. A nurse is caring for a patient with acute pancreatitis. Which order should the nurse question? NPO status, IV morphine, NG2 placement, high fat diet. Correct answer is option D, high fat diet. Which cell is primarily responsible for antibody production? B cells, T cells, macrophages, neutrophils. Correct answer is option A, B cells. What is the main goal in the nursing management of a patient with increased intracranial pressure? Elevate blood pressure, promote frequent suctioning, prevent hypercapnia, reduce urine output. Correct answer is option C, prevent hypercapnia. What is the antidote for organophosphate poisoning? Naloxone, protamine sulfate, vitamin K, atropine. Correct answer is option D, atropine. A post-operative client is unresponsive to verbal stimuli but responds to pain. What is the GCS score for motor response? 4, 3, 5, 2. Correct answer is option A, 4. Which hormone inhibits osteoclast activity? Parathyroid hormone, calcitonin, vitamin D, aldosterone. Correct answer is option B, calcitonin. What is the rationale for administering lactulose to a patient with hepatic encephalopathy? Correct electrolyte imbalances, reduce bilirubin levels, decrease blood ammonia levels, promote protein metabolism. Correct answer is option C, decrease blood ammonia levels. What is the primary concern for a patient with facial burns? Airway obstruction, pain management, risk of infection, body image disturbance. Correct answer is option A, airway obstruction. A nurse is evaluating the effectiveness of mannitol in a patient with cerebral edema. Which parameter is most important to monitor? Serum sodium, serum glucose, urine output, intracranial pressure. Correct answer is option D, intracranial pressure. A client with myasthenia gravis is at highest risk for dehydration, aspiration, hypertension, seizures. Correct answer is option B, aspiration. Which cardiac pace corresponds to the QRS complex? Atrial depolarization, ventricular depolarization, ventricular repolarization, atrial repolarization. Correct answer is option B, ventricular depolarization. A client with tuberculosis is placed on which precautions? Airborne, droplet, contact, protective. Correct answer is option A, airborne. Which cranial nerve controls the gag reflex? Cranial nerve 5, cranial nerve 7, cranial nerve 9, cranial nerve 3. Correct answer is option C, cranial nerve 9. Which electrolyte imbalance is commonly associated with flattened T waves and muscle weakness? Hypernatremia, hyperkalemia, hypomagnesemia, hypokalemia. Correct answer is option D, hypokalemia. Which part of the brain regulates hunger and thirst? Cerebellum, medulla, hypothalamus, thalamus. Correct answer is option C, hypothalamus. Which ECG finding indicates hyperkalemia? Peak T waves, U waves, ST depression, flattened T waves. Correct answer is option A, peak T waves. What is the primary mechanism of action of warfarin? Inhibits platelet aggregation, inhibits thrombin directly, blocks vitamin K dependent clotting factors, activates antithrombin 3. Correct answer is option C, blocks vitamin K dependent clotting factors. Thanks for watching. Subscribe to the channel for the latest informative MCQs.